Welcome to Marrow Masters Season 12, brought to you by the National Bone Marrow Transplant Link and sponsored by Sanofi. The NBMT Link, established in 1992, strives to help patients, caregivers, and families cope with the psychosocial challenges of bone marrow and stem cell transplant, from diagnosis through survivorship. Season 12 of our show focuses on the important question of, I'm home. Now what? Here's your host, Executive Director of the NBMT Link, Peggy Burkhart.
Welcome, everyone. So today we have with us Ailey Armstrong, who is a licensed clinical oncology social worker at Fred Hutchinson Cancer Center in Seattle, Washington. Ailey has worked with patients undergoing allogeneic and autologous transplants for the past 8 years and will share with us today her experience with patients ready to transition home post-transplant. Welcome, Ailey.
Really happy to be here with you today, Peggy.
Well, we're so happy to have you with us today. So, Ailey, let's begin. Let's talk about when a patient is still at the hospital, they're getting ready to go home, and they're about to be discharged. What should folks know that might help make that transition a bit easier?
Yeah, no, that's a really great question because that's a big transition. And one thing that I just want to start out with is, a lot of the information and ideas that I'm sharing today, I've really learned from the people that I've worked with over the years, the patients who have actually gone through these transitions and have shared with me what's been helpful for them during this process. So I just want to give credit where credit's due. This is information that I've gleaned from people who've actually been living this experience over the course of some time. I think the first thing to know is that for somebody who's getting ready to discharge from the clinic or hospital where they've gotten care in that acute post-transplant period, you are still likely to need at least some caregiving support once you get back home. And, the caregiving support up until now has been pretty intensive, and hopefully some of that intensity won't be needed anymore, but you still are going to need some support once you get back home. So I think the place to start is by thinking through what you're likely to need on a number of different levels or realms once you get back to your house. And that can be thinking about everything from medication management to meals, to transportation, all of the pieces that are going to need to be there when you get back home. Some of those pieces you may find you can handle on your own now, but some you may need some additional help. So making a list of all of those pieces and then writing down in each of those realms, is this something that I can manage on my own with some help? Or is this something that I'm going to have to call in some additional resources or supports for? For example, rides to medical appointments. Probably going to need some assistance with that. So who can I reach out to help me with that piece? Meals or groceries, that might be something I can do on my own.
That makes sense.
Yeah.
And even as far as planning to go back to work.
Yeah, absolutely. What do I need to do in order to make that happen? Do I need to get information from my doctor about what I can and can't do when I initially want to start back to work? Do I need to connect with my employer about requesting accommodations? So just trying to think through each of those pieces step by step so that you can kind of make a plan from there.
Oh, that sounds good. So let's talk about support and resources, Ailey.
Yeah. So one thing that you might want to think about is first connecting with the social worker or the patient navigator at the transplant center, who is somebody who has probably helped a lot of people through this process and can help you think through what are the pieces you need to have in place and who are the supports that can help you with that at home. You may also want to find out if there's a social worker or navigator at your primary oncologist. So you'll have somebody that you can connect with after you get discharged that can help you with that process too. And again, those folks are really there to help you find resources around financial assistance, around returning to work, as well as connect you with social service organizations and agencies that can provide ongoing support too.
Yeah, we find that's important. So now they're home and there's neighbors and community members. How can they help?
That's a really great thought. What I hear from a lot of folks who've been through this process is that, They've had a team of caregivers, family or friends that have been working with them during the transplant, but now they're back home and they may find that they actually have a wider network that they can tap into of people who may not have been local to the hospital or the clinic where they were getting treatment, but who might be available now that the patient is back at home. For example, as you were saying, neighbors, members of a church congregation, social groups, extended family. Reaching beyond, the core team of caregivers can be a really great idea at this point in transplant first, because a lot of those folks really do want to help, and they haven't really been able to during the acute post-transplant period. And also because your core caregiver team may need a break. So really thinking about who is my wider support network that I can tap into now that I'm back at home is really, really important and useful for a lot of folks.
I was just thinking that when you said that, it almost is a great way to give the caregiver a chance to get acclimated at home with everything that they're going to be dealing with. So excellent idea to tap into that next grouping of support. We all know that communities, people want to help.
Yeah.
They just don't always know what to do. So it's really guiding them too and on ways that they can be helpful during this critical time.
And one really great way to do that is to identify one or two people, maybe people who've already been part of your core care team, or maybe people that have some interest in helping now, and asking those people to really be the coordinators for your caregiving once you get home so that they can kind of circle the wagons, all of that extended group of caregiving support that you might now have access to, and they can kind of plug in people where they would be best suited. Are some people really available for transportation? Are some people able to help out with yard work or cleaning? Really allowing those coordinators, those friends, family coordinators to take over that role so that they can do that heavy lifting. Because that's, that takes some time and energy. And when you're just getting out of the hospital or discharging from the clinic, you might not have all of that energy to manage that group of people. But I bet somebody might.
Great idea. And what else can people utilize when they first get home?
Well, a lot of people experience some temporary cognitive changes after transplant. We just know that that is a side effect of going through this really significant medical procedure. And so thinking through how you can use lists and calendars and apps on your phone to track all of the different pieces. Again, it's great to have some people that are willing to help you coordinate some of those pieces, but you can do some of that work on your own, and try not to rely too much on your own memory, because we know memory can be a little spotty post-transplant, but using apps like MediSafe to track medications, working with your medical team to come up with a system for tracking key medical information and symptoms, for tracking nutrition, if that's something that you're still needing to do. Really thinking about what your systems for managing all of these complex pieces need to be before you get to the point where you're feeling overwhelmed right after hitting the threshold of your home.
Yes, that sounds good. And we can include some of these apps and different groups in the show notes. So let's move on, Ailey, and talk about potential contact with the hospital once you're home. We know how important it is to feel that you can call your center, you can ask questions. So what can folks do to be the most organized about that?
Yeah. Well, I would say most hospitals and clinics are really good about making sure that you have all of this essential information before you discharge. And if you feel like you're not getting that information before you're ready to leave, make sure that you talk with your medical team about who do I contact if I have a medical concern? Who does my doctor contact? Who do I report symptoms to? What if I have questions about what I can and can't do? making sure that you have all of that contact information, that your core caregivers have all of that contact information before you leave is really important. Again, most centers make sure you have that, but always ask if you haven't gotten it already.
Great idea. So let's talk about when someone first gets home. What's normal? What can they expect?
I think there are so many things that are normal. It is really normal to feel incredible relief and excitement about finally getting to be back at home after going through this significant transplant period. I think everybody experiences, or most people experience like this, oh my gosh, I'm so happy to be done with this part of my treatment.
Absolutely.
At the same time, it is also very normal to feel a wide range of other feelings, such as worry and anxiety. I think any transition that we go through brings feelings of wondering what the future is going to be like. For people that are going through transplant or that have received a transplant, often those feelings at the point of discharge are, oh my gosh, how will I manage without my transplant team? These people that have been monitoring me so closely for so long, what will I do without them?
We hear that often.
Yes. Yeah. Or, will my regular oncologist know how to treat my post-transplant symptoms? Will they know what to do if certain things come up? How will I handle being back at home is another question that people have. It's been a while for a lot of folks. And so just wondering how things are going to feel, how the regular home activities are going to get taken care of. Those are all really normal things.
Yeah, we have one of the other people that we interviewed for this season talks about getting home, Layla, and she had been with her daughter in temporary housing, and it was the girls' pad, and then they got home, and her son and her husband, they had kind of had their own way of doing things for a while, and really, merging those worlds again. Yeah, it was quite interesting how that went.
Absolutely. And these are not the things that people really ever anticipate when they go through this. So there is this period of readjustment. People often feel some frustration or even anger after transplant. Like, why don't I feel better by now? Why am I still feeling all of these side effects? And also there's kind of the feeling of like, everyone in my life seems to think that I should be back to normal by now, but I'm not. And so there can be some real frustration around those thoughts, those feelings.
Yeah, we hear that often. And what about even the grief of it all and the sadness?
Yeah, I think so many people just feel like, my life really looks different than it did before, certainly before transplant, but also before I was ever diagnosed with cancer. And, the feeling of I can't do the things that I enjoy or the things that are important to me. Sometimes that's because of fatigue. Sometimes that's because of infectious risk. I meet so many people who are gardeners or hikers or woodworkers who can't return to some of those activities right out of the gate. A lot of people say, I just don't feel like myself. And I'm really not sure if I'm ever going to feel like myself again. So those are really normal feelings too.
Wow. So Ailey, let's talk about managing the psychosocial. We've talked about that a bit, but let's dig in even a little deeper on the psychosocial support.
Yeah. So, I think what we've been saying is that it's really common for people to experience significant changes in mood and feeling after transplant, particularly once this most acute phase is over. When people have just gotten their transplant, and certainly in that first 3 to 4 months after transplant, often the focus is really on the physical symptoms, the crushing fatigue, the gastrointestinal symptoms, the nausea, the nothing tasting good. All of those things kind of become primary. And it's often a matter of managing those physical symptoms day to day or hour to hour or even minute to minute, right? But once people have moved past that acute phase, they really are able to reflect more on the emotional part of the experience. And that can sometimes bring forth a lot of the feelings that we've already mentioned: anxiety, grief, fear, sadness, anger. I think the first two things I want to say that are really important are, first, it is very, very important for you to talk with your medical provider about any mood or sleep changes that you're experiencing, because those things are treatable. You don't need to suffer. There are things that can be done to help you feel better. And so talk with your medical provider if you're experiencing those things. The other thing I want to say that is really critical is that if you have any thoughts of self-harm, there are resources that are immediately available now. Certainly tell your medical provider, but you can also call the National Suicide and Crisis Hotline, which is just 988, very simple phone number, or go to your nearest emergency department. So those are the two big pieces that I want to share.
Well, thank you.
Yeah.
That's so important that we have those resources. We hopefully don't need them.
Yeah.
And it's normal to possibly need them.
Yeah, absolutely. Absolutely. So just want people to know those things. But in terms of just dealing with the emotions that come up for everybody post-transplant, I think the big thing is to really give yourself the time and grace to process those emotions. And when I say process those emotions, what I'm saying is acknowledge the emotions that arise. You don't need to ignore them or tell yourself you shouldn't be feeling that way. Emotions are normal. And, it's when we try to push them aside or distract ourselves from them or avoid them that we kind of get in trouble. Emotions are kind of like quicksand. The more you struggle against it, the more you kind of sink into the negative emotion. So if you can just acknowledge the emotion, allow what is to be there and notice it, I think that's a good place to start. When you're acknowledging the emotion, what you might do is that if you notice that you're feeling sad, or if you notice that you're feeling frustrated, is just say to yourself, I'm feeling sad, or I'm feeling frustrated, or even I notice that I'm feeling sad or I'm feeling frustrated. And notice where you feel that in your body. And I think sometimes we can get kind of disconnected from our bodies, although that seems a little hard to imagine when your body has been through so much. But try to notice where you feel that emotion. Sometimes people feel sadness as kind of a hollowness in their stomach or a pressure behind the eyes, or frustration can show up as kind of a tightness in the chest. So noticing it, naming it, finding where it is in your body, and just allowing that noticing to happen. You might also notice that feelings tend to shift over the course of the day. You might feel sad earlier in the day, and then later notice that you're feeling frustrated, and then maybe something happens. You get a phone call from a good friend, and you feel some joy or some pleasure. So feelings shift. Nothing stays forever, and feelings can kind of be like weather. They can be really intense at times. They can be really intense at times, but they also fluctuate. Doesn't stay one feeling all the time. And so try to notice that too.
That's a great way to look at it. I really like that. So Ailey, what are some methods or strategies to deal with these emotions?
So when we're experiencing difficult emotions, it's often because we're thinking about something that happened in the past that maybe we feel bad about, or that we miss, that we are grieving, that we wish we'd done differently. Or we're thinking about something in the future, something that we're worried about happening. So I think the key thing that can be helpful for people, or that people tell me is helpful, is to try to really focus on the present, to kind of move away from those thoughts about the past or the future, and really kind of tune in to what's happening right now. And there's this great exercise that I've learned and worked on with patients called dropping anchor. And the idea is when you're in a really negative thought spiral or feeling really overwhelmed by these thoughts of the past or the future, and it's kind of blowing you around like a boat on a rough ocean and you're in the middle of the storm, what you want to do is really drop anchor in the present so that you don't feel so blown around. And so to do this, the first step is, again, to really acknowledge the thoughts and feelings that you're having. As I was saying before, I notice that I'm feeling really scared right now. The second piece, after you make that acknowledgement of the emotion, is to connect with your body in some way. And so say you're sitting in a chair, you're going to press your feet really hard into the floor. Maybe straighten your spine, maybe shrug your shoulders a little bit, maybe move your eyebrows up and down, whatever kind of gets you back into your body in this moment. That's what you're going to do. And then you're going to engage with your surroundings. So acknowledge the emotion, you're moving back into your body, and then you're going to notice what's happening around you. What are 5 things that I can see right now? I can see a window, a chair, my dog over in the corner, a television set, and my husband. What are 4 things you can hear? I can hear the dog snoring. I can hear the bird outside. I can hear the television. I can hear the heat on. What are 3 things you can feel? I can feel my feet against the floor. I can feel myself sitting in this chair. I can feel my hands in my lap. So you're really just tuning in to what is happening right now. And you might need to do this several times. But the idea is not to make the anxiety or the fear or the anger or the feeling go away, but just to reground yourself in what's happening right now so that you aren't feeling so carried away by the storm of emotion.
Oh, I love that. I want to try it. I think this could work for all of us.
It can, and I use it too.
So, Ailey, let's talk about what survivors can control and why this is so important.
Yeah. Well, we know as human beings, there are a lot of things that are outside of our control, right? We can't control what has happened in the past or what's going to happen in the future. We can't really control what other people think or do or say. And we really can't even control the thoughts and feelings that come up for us. Those just happen. And the hard part, too, is that we can't control cancer. And I know a lot of people worry after transplant that the cancer might come back. And that is something that we can get medical assistance around. There can be plans. We can do our part to take care of ourselves. At the same time, cancer is going to do what it will do.
Mm-hmm.
What we can control is the physical actions that we take and how we choose to respond to the thoughts and feelings that come up for us, to the actions of other people, so we can choose what we do. And in thinking about that, I often think that we can choose to move toward our values, toward what's important to us. Even if our thoughts and feelings tell us that we shouldn't, we always have that choice. And so one thing when I'm talking with people who are struggling, one thing that I ask them is, how do you want to show up in your life today? How do you want to show up for yourself? How do you want to show up for your family, for your community, for your friends? How do you want to be? And this is different from how do you want to feel. How do you want to be might be, I want to feel present. I want to feel creative. I want to feel caring. I want to feel generous. I want to feel attentive. And those are things that you can move toward through your actions and your responses, regardless of thoughts and feelings.
Oh, I love that.
Would it be helpful for me to give an example of that?
Oh, sure.
Yeah,
Please do.
Yeah. So say you have a group of your best friends who want to see you after you've gotten home following your discharge from the hospital. And they've made it so, you'll all meet outside. Everybody's going to wear masks. It's going to be as safe as it possibly can be for you to be around other people. But you're feeling really anxious about this. You haven't seen people in a while. You're afraid of what they'll think when they look at you. You're afraid of the questions they're going to ask. You don't want to talk about your treatment. There are all these things coming up for you that make you really nervous and uncertain and self-conscious. And so you have a choice in that moment. You can choose to act toward those feelings of worry, of anxiety, which of course are so normal, is so understandable. Or you can choose to act toward your values, which are, I love these people and I want to be a good friend to them, and they have shown their care for me, and it's important for me to show up for them too. And so the thinking is that moving toward your values will ultimately be the most rewarding for you and hold you in the most integrity with yourself. It's not necessarily easy all the time. But what most people find is that moving toward values rather than feelings helps them feel better overall, particularly over time.
Oh, that's wonderful. And it really makes sense. So thank you for sharing that.
Yeah.
So Ailey, what about having structure to the day and creating a new routine? Dare I say the new normal?
The new normal. Oh,
such a love-hate.
It's such a love-hate feeling around that phrase for so many people. And yeah, what we know, what people tell me about their experience is that structure really helps, particularly in that first period after discharge from the hospital or the clinic where life has been so structured, right, around medical appointments and all of the things that have to happen during that time. Going home and losing some of that structure can actually be really hard. What we know is that routines work as an important scaffolding for everybody's lives. They help give us a sense of agency and consistency. We also know that the routines that people have before transplant may not work after transplant. In fact, they're going to have to change. So thinking through what you need to do to create a new routine, what that would entail, and being really deliberate about it, maybe even writing it down, is really helpful. So ideally, any routine would include both the essential activities, such as scheduling your medications and appointments, when you want to eat every day, hygiene stuff and making sure that you're getting a shower or bathing or doing something hygiene-wise every day. So including that in your routine, as well as activities that you enjoy or that are important to you, the things that actually bring you life. And that may be as simple as connecting with a friend or going for a short walk or taking care of a household task that needs to get done and that will actually feel good once you get it done. So having a routine where you are really deliberately scheduling those things, I think many people find that really helpful, even though it can seem like, oh, is this really necessary? It actually is really useful.
So Ailey, this has been so great. As we close out this episode, do you have any final tips, pearls of wisdom, anything else that we didn't cover that you want to share? Although you shared so much, I'm trying to guess if there's anything else.
Yeah, well, I guess there are two main things that I'd like to leave everyone with today. The first one is some days are just going to be hard. That's just reality. And during those days, the best and really maybe the only thing that we can realistically do for ourselves is to try to not make ourselves feel worse about ourselves and our circumstances. There's this writer, Megan Devine, who has written a lot about grief. Her book is actually called It's Okay That You're Not Okay, which I think is the best title for so many things. But she talks about this move toward wellness rather than worseness when we're having a really hard day. So she kind of suggests, if you can ahead of time, making a side-by-side list of all of the thoughts, ideas, images, activities, people that you know that actually help you to feel calmer versus the ones that you know actually make you feel worse. For example, you might know that you tend to feel calmer after talking with a certain friend. This is just somebody who helps you feel very centered and calm, but that you definitely feel worse if you talk with this other person or if you stay in bed all day. So really on those days that are so hard, to try to move toward the things that you know just won't make you feel worse. They may not solve everything. You may still have a really hard day, but you're not actually compounding the problem by doing things that make you feel a lot worse.
Oh, good stuff.
The second thing I'll say, and I know people have probably heard the term self-compassion before and may have different ideas about it, but I think self-compassion and turning toward ourselves with kindness and patience and grace when we're going through something as difficult as a stem cell transplant and recovery from a stem cell transplant is critical. And sometimes people struggle with that, with offering themselves that self-compassion. We all have a lot of shoulds. I should be doing this. I should be doing that. There's something wrong with me that this isn't happening. But what I would encourage people to do is to turn to themselves like they would a beloved friend or a beloved family member and treat themselves in that way. If it were your friend, you would have their back. If they were struggling, you would offer them comfort and encouragement. And it's so important to offer yourself that same kindness as well. So I think that's what I would like to leave everyone with today.
Oh, wow. Oh, Ailey, thank you so much. This is just terrific. And wow, it's going to help so many people. Thank you for your time today.
Of course. And thank you for inviting me to share this information. Again, these are things that I've just learned from people that I've worked with who've walked this road and who sometimes can offer this wisdom. And so I'm happy to be able to pass that along to other folks who might benefit from it.
And that makes it really special that a lot of this is actually from survivors that have walked this walk. You know, people love to hear the best tips from people that have already gone through what they're going through. And don't be humble. A lot of this is your incredible expertise too. So definitely a win-win. Well, thank you again.
Of course. Thank you.
This has been the Marrow Masters podcast. If you know someone who would benefit from the information in our show, please share this episode with them. And don't miss future episodes of our show. Follow Marrow Masters for free on Apple Podcasts, Spotify, YouTube, or wherever you're listening right now. And to connect with the National Bone Marrow Transplant Link, visit nbmtlink.org or tap the link in our show notes.